We had a really great Crit Bits discussion with Haney Malamet around some advanced topics in chest tube placement. And one of the big things we touched on is how do you know if your chest tube is in the right place and doing what it's supposed to do? Haney really focused on three different things. Number one was tidaling. This is the oscillation in that water-sealed chamber. That's good. You want to see tidaling with respiration, the rise and fall of that level as the patient breathes. Number two is bubbling. You want to see air bubbles in that water-sealed chamber if you are draining a pneumothorax with that chest tube. Down the line, if you have continued bubbling, even though the pneumothorax should have resolved by then, it tells you that you've got an air leak. That's something for people to manage down the line. But for us, we want to see bubbling to tell us that we actually put the chest tube into the pneumothorax. And then finally, number three is to look for sub-Q emphysema. Most patients with trauma who have a pneumothorax are going to have a little bit of sub-Q emphysema. But if that subcutaneous emphysema is growing, if it's worsening after your chest tube placement, then you really have to question whether you've got one of the holes of that chest tube in the subcutaneous tissue. It's not actually in the chest. And so instead of draining air, it's actually just kind of pumping air into that sub-Q space. So if you see that sub-Q emphysema growing, it means that your chest tube isn't in the right place. You're probably going to have to remove it and then place a new chest tube to continue that drainage.